Hello, we're doing chapter 23 of module 154. This is our last chapter of module 154, and this chapter is kind of special to me. And the reason it's special to me is it's the very first chapter that I actually lectured when I started teaching at Unitech. So anyway, without further ado, we're going to share our screen and do our little lecture. Okay, here we go. Chapter 23, Eye, Ocular, ADNEXA, Auditory, and Operating Microscope. So the Eye and Ocular ADNEXA is 65091 through 68899. Your terminology in this section is extremely important, and code descriptions often vary only slightly. So you're going to have to pay attention to your wording. Be very, very specific. Codes divided anatomically, for example, eyeball, conjunctiva, anterior segment, posterior segment, ocular adnexa. Some codes specifically for patients previously operated on. There's a lot of bundling in this section. For example, subheading posterior segment, prophylaxis, category notes indicate the following descriptors intended to include all sessions in defined treatment period. So let's talk about the eyeball, 65091 through 65290. The removal of the eyeball, you're going to report with a evisceration, 65091 or 65093, removal of contents of the globe, enucleation, yes, 65101 through 65105, removable eye, leaving orbital surface, orbital structures intact, externation, 65110 through 65114, removal of eye, adnexa, part of the bony orbit. Associated skin grafting reports separately with these 15 codes listed on the bottom. So let's talk about the removal of foreign bodies. 65205 through 65265, it's extensive notes. Removal from external or intraocular, and it can be done with a slit lamp, or you can use a slit lamp as a tool for this procedure. Microscope with high intensity light source focuses long, narrow beam of light. Different codes for with or without slit lamp. For example, 65220, foreign body removal without slit lamp. Then 65222, foreign body removal with the slit lamp. You guys have been coding long enough to know that you need to look for with or without. Anterior segment, 65400 through 669999. It includes the cornea, the anterior chamber, the anterior sclera, iris, ciliary body, lens, intraocular lens procedures, and other procedures. Let's talk about the cornea. Keratoplasty is the repair of the cornea, 65710 through 65757. Penetrating keratoplasty is full thickness of cornea removed and replaced with a donor cornea. Aphakia is the absence of lens of the eye, and pseudophakia is the presence of an artificial lens after cataract surgery. Anterior chamber, 65800 through 66030. Guys, haven't said this yet, but you really do need to have your CPT books out, and you need to be looking at these codes while we're reading through. That way it's going to make a lot more sense to you. So, paracentesis, removal of fluid. The needle is inserted into the anterior chamber and the fluid is withdrawn. Goniotomy is a surgical procedure using the going lens to view the eye, 65820, is usually for congenital glaucoma. And synchia adhesions, posterior synchia adhesions of the iris to the lens. Anterior synchia is adhesions of the iris to the cornea. Trabeculectomy ab externo, 65850, involves the trabecular meshwork, iris scleral junction, drains aqueous humor, and the surgeon reshapes or punctures the meshwork as a treatment for glaucoma or trauma. That's going to be 65800 through 66030. Iris ciliary body, 66500 through 66770. Some examples of these codes would be an iridectomy performed for removal of a lesion, 66600, the treatment of glaucoma, 66625 or 66630. Laser iridotomy or iridectomy, 66761, and photocoagulation is 66762. So now we're moving into the lens, 66820 through 66940. So cataracts. The nuclear cataract, which is the most common, is center lens or the nucleus due to the aging process. Cortical cataract forms in the lens of the cortex and extends outward, common in diabetics. Subcapillary cataract forms at the back of the lens, assigned based on the type of procedure that's performed. So intracapsular is ICCE, or extracapsular is EECE or ECCE. So more on the lens, the removal and lens placement, 6830 through 66990. Extracapsular cataract extraction, the ECCE partial removal, removes hard nucleus in one piece and soft cortex in multiple pieces. Intracapsular cataract extraction, ICCE, total or removal, removes the lens and capsules in one piece. Fasciomulsification, small incision into the eye, introduction of the probe, high frequency waves fragment the cataract and the lens placed through small incisions, on the same small incision, sorry. So posterior segment 67005 through 67229. Codes include virtuous procedures for removal of humor of the eye, repair of retinal detachment, and destruction of lesion of retina or choroid. Extraocular muscles 67311 through 67399. Strabismus surgery corrects muscle misalignment. Horizontal muscles are 67311 through 67312. Move the eye side to side. Vertical muscles 67314 through 67316. Move the eye up and down. And the codes are divided by the type of repair and the number of muscles that are repaired. Eyelids 67700 through 999. A blepharotomy is 67700. It's an incision into the eyelid for drainage of an abscess. Blepharoplasty is the repair of the eyelid. Codes are in the integumentary system 15820 through 15823. Codes in the eye and ocular ADNEXA are 67916, 1723, and 24. The selection of code depends on the technique used for the repair. Eyelid modifiers, E1 through E4. E1 is the upper left eyelid. E2 is the lower left eyelid. E3 is the upper right eyelid, and E4 is the lower right eyelid. So let's talk about the auditory system. So the auditory system is, of course, how we hear. It's our ears. Codes are divided by the external ear, middle ear, internal ear, and the temporal bone middle fossa approach 69950 through 69979. Outer and middle ear function is conduction of sound waves through the ear. The inner ear contains structures that receive the auditory waves and relay them to the brain. The operating microscope is 69990. Okay, divisions of the auditory system. Sorry, guys. External, middle, and internal ear. Auditory system is further divided on procedure: incision, excision, removal, for example, foreign body, repair, and other. External ear is 69000 through 69399. Incision, drainage of abscess or hematoma, simple is 69000. Complicated is 69005. Excision, biopsy, external ear, 69100. External auditory canal, 69105. Excision of external ear, partial or complete, 69110 and then 69120. The removal of foreign bodies based on with or without general anesthesia, an impacted cerebrum, irrigation or lavage, instrumental, and then you need to know that 69209 bundles with 69210. And of course, you'll find that note in your CPT. Otoplasty. It's for protruding ears. You may or may not decrease external ear size, and you need to add a 50 modifier if you're going to be doing both ears. Middle ear, 69420 through 69799. Eustachian tube connects middle ear to the back of the throat for drainage. The fluid collects in the middle ear when the tube malfunctions, prevents air from entering the middle ear, and pressure builds. Our surgical intervention would be a myringotomy, incision into the tympanic membrane. It relieves pressure and can drain the pus. Tympanostomy, gotta slow down when I'm reading it. Incision and placement of the PE tube, the pressure equalization, repair of the eardrum and hearing mechanism. Myringotomy is included in a tympanostomy, which are tubes. Middle ear, canalplasty or canaloplasty is a reconstruction of external auditory canal. Codes are based on stenosis or congenital defect. Caution, canalplasty, canaloplasty are bundled into some middle ear repair codes. It's going to be in your notes, so make sure you're reading your notes. For example, 69631 through 69646. More on the inner ear incision and or destruction, 69801 through 69806. A labyrintotomy is a surgical incision into the cave-like structure or labyrinth of the inner ear. If pressure builds within the labyrinth, may result in vertigo, ringing, or hearing loss. 69801 is transcanal. Excision, 69905 through 69915. A labyrinthectomy, incus and staples are removed, and the codes are based on approach, such as transcanal or post-auricular, which means behind the ear. It's a little tricky, isn't it? Introduction, 69930. Cochlear device implant, a computerized device. It can restore partial hearing. It's a receiver on the outside of the skin behind the ear over the site of the transmitter. Can be a transmitter implanted under the skin, or the sound processor connected to an electrode implanted in the cochlea. Temporal bone middle fossa approach, 69950 through 69979. Surgical approach is used with repair vestibular labyrinth nerve, 69950. Decompressed facial nerve, 69955. Decompressed internal auditory canal, 69960. And removal of neoplasm from temporal bone, 69970. So operating a microscope, 69990. It's used with procedure using microsurgical techniques. Code in addition to the primary procedure performed, unless the primary procedure description includes the microsurgical techniques. For example, 15758 is free fascial flap with microvascular anastomosis. Note the following: 15758 is the statement, do not report code 69990 in addition to code 15758. So you need to always read your notes. Okay, so yes, a lot of numbers and a lot of things. Pull out your CPTs, follow along those numbers, and it's going to make sense. You guys have a great afternoon.